Now, while we were away, we had a new strain of COVID and a plan for a new vaccine. And in fact, in just the last few hours, Karine Jean-Pierre says we are going to be pushing a new vaccine starting in September. I didn't have time to get that soundbite, but great.
That's
so
from the White
let's
House, yeah.
look at what we've got to deal with. Now, the CDC says that this new variant is more likely to infect you if you got the vaccine previously.
Wait, repeat that.
I'm going to show it to you. This means that if you've been vaccinated for COVID, you are more prone to be infected by the new strain of COVID. This is effing crazy, you guys. It's the craziest thing. It is on the CDC's website, and I'm going to show it to you. So many people are going to wonder why they do that. Why we take that vaccine, meaning we're going to get the next one. We're more likely. So hold on to your hat. Now, here's the president on vacation in Lake Tahoe saying he has asked Congress to fund a new vaccine with your taxpayer dollars.
Mr. President, can you say anything about the uptick of COVID cases and the new variant?
Yes, I can. Matter of fact, I signed off this morning on a proposal we have to present to the Congress a request for additional funding for a new vaccine that is necessary, that works. And tentatively, not decided finally yet, tentatively it is recommended that, it would likely be recommended that everybody get it, no matter whether they got it before or not.
Okay, I apologize. I don't remember that being quite so inaudible. Who knows what the heck he's mumbling?
They love to do interviews by like an aircraft carrier or like a
right,
like
but
a Harrier
he's
jet.
Also so indiscernible. So,
but I can paraphrase if you'd like. He just said, he just authorized this morning additional funding for a new vaccine.
Yeah,
a new COVID vaccine from your federal government.
Okay, so as
we're paying for this one too, I guess.
Yes, let's talk about that. Let's talk about, as an American taxpayer, you may not want to pay for this thing, given that the original vaccine did not do what they promised it would do and proved to be more dangerous than we were told. But recall that the last vaccines, at least we made some money back because the last vaccines used patents owned by the National Institute of Health, or the NIH, and Pfizer and Moderna both paid big bucks to license those patents from the U.S. government. We found that out when Moderna fought not to pay quite so much. So whether or not you want a vaccine, at least it may be a good ROI on your taxpayer investment. Who cares if it works or hurts people, right?
Right.
Given that we are being told that COVID cases are on the rise, at least we'll, make some money back. Now, there's no way that anything that comes out of Big Pharma is going to be fully approved. We know this. The last COVID vaccines were only ever given emergency use authorization. And even now, RSV and postpartum depression drugs are fast-tracked through FDA approval. So zero chance this will get full clinical trials and full approval. We've discussed those recently at length. If you haven't seen those where we go over the RSV and the postpartum depression approvals, I recommend you refer back to them so you know the standards with which modern medicines are approved. So about that new variant, here it is. It's called the BA.2.86. This is the recent CDC warning about it. Now, I highlighted this at the bottom. Let's just zoom right into that, right? BA.2.86 may be more capable of causing infection in people who have previously had COVID or who have received COVID-19 vaccines. What? People who have had the vaccine are more susceptible to BA.2.86. What the actual shit, you guys? I'm sorry.
I mean, that's kind of convenient because you got that's your demographic. Those are the people you want taking it anyway. So it's like, hey, you already took it. So,
Yeah.
Right.
Take it again. Take it. This time we're really going to get it right.
Yeah. I'm sorry I said the S word. It's my birthday, so please don't send me an email about it. I'm just going to take a privilege. But that feels like a subterfuge. Don't you think? Why would we trust them now? The original vaccine may make you more susceptible to new COVID. It, did more harm than they admitted, and you can still catch and spread it even if you take it. So what? I give up.
Roland in our chat, Roland Dussin says, redacted, that was the plan. That was the plan all along. I guess.
Right.
Yeah, makes sense, right?
And we were warned that new variants would adapt in order to get around this vaccine. We just, made fun of people who warned about it. Now, this feels like I give up, only I can't give up because I have questions. And while we are still allowed to ask those questions, we will ask those questions. But I do have questions about what questions I can ask, given that we are on YouTube and an updated YouTube policy says that YouTube doesn't allow content that, here's what they say, contradicts local health authorities or the World Health Organization. So this is a little concerning. This is the new mid-August update to YouTube's policies. And I think it's worth you seeing what we can talk about so that at least you know what the playing field is here. Now, obviously, this is like marching orders for me as a content provider, but also for you to know what you're being allowed to see, because the WHO did not give us consistent guidelines during the pandemic. We know this, right? But also, these bodies approve things based on what? And that's what we've been focused on here on Redacted, is when a new drug is approved, we look at the clinical trials and they look to us like not stellar grades, but still they're being approved. So can we then go through those clinical trials and ask why was that approved? Given, for instance, the FDA did authorize the new RSV vaccine for elderly people, but 11 people died in those trials. And so are we supposed to ask those questions, or should we just do what the mainstream media does and champion it and ignore those 11 people? Screw them.
Well, and
right?
Yeah.
Couldn't they reevaluate who they're considering their experts? Because if we would have been able to highlight the people that were consistent throughout and ended up being right the whole time, if we could just follow them instead and then use the others as a guideline, we'll look at what they're saying, but these are the people that were correct throughout.
Right, that had the vaccine protocol, or had the different treatment protocols. Dr. Peter McCullough, Pierre Corey, etc., who had Malone, who had treatment options that were working. And we're keeping people off of ventilators. Once people got on ventilators, of course, that was the problem. Once they got on ventilators, it was a death sentence.
Yeah. I'm extremely concerned about this because, when we present, for instance, these RSV vaccines, we don't say to you, hey, take this or don't. We don't say that at all. We just say, look at this clinical trial. Do you think that merits full approval? We have questions about it. These things show concerns. Will we be allowed to do that? Or are we just supposed to say full approval? Huzzah. Right? This seems to me to not be clear.
That's a very frustrating thing because we got suspended once for reading Pfizer's own studies. We were reading the studies. We were reading their information. So if that's not okay.
Right. And they called it medical misinformation. And then we got our show Redacted was redacted for a week, blocked. We couldn't post anything because they claimed medical misinformation. But we appealed it. We said we were reading from Pfizer's own documents. Didn't matter.
I'm feeling like we are being primed with a playing field that will not allow us once again to discuss what's actually happening, like happened during the first pandemic, the first phase of the pandemic, I guess, now that we're given this new phase, BA.2.86. Now, the federal government is not supposed to be telling social media what to censor because of the federal case ruling that happened in July. So if we have a new vaccine and a new strain of COVID, maybe we'll be more free to discuss it this time around, even though YouTube has taken it upon themselves to decide to censor based on these new parameters. But okay, we've seen how the government punished and silenced speech around the vaccine and lockdowns. What about masks? Well, a new study from this spring shows that surgical masks used, the single-use ones, the N95s, contained all manner of toxic chemicals. This study was published in April, but it was shared by the National Institute of Health and surprisingly, shockingly, received very little media coverage. This study looked at the amount of what they are calling VOCs, volatile organic compounds, in COVID masks. They found that those single masks had concentrations of toxins between 22 and 147 times higher than cloth masks.
Oh, great. So
only the cloth masks were shown ineffective at blocking out COVID particles, and Also, it was shown that breathing back in your own oxygen has a toxic effect. We've talked about those studies. And these toxins can be linked to health issues such as headaches, nausea, organ damage, cancer. What's worse, that some of these single-use masks had these toxic concentrations when the weather was hot, that they increased by a 119 to 299%.
Think about those poor kids in Italy. I remember the images we showed them here on the show. These are kids, and it was boiling hot. They don't have air conditioning. They don't believe in air conditioning, I think, in Italy at all. And seriously, it's like, and it's the worst. And they, in schools, like, these poor kids are in like uniforms, and they're wearing masks, and they're sweating their asses off, and they're being forced to like breathe in these awful toxins in these masks. And there's absolutely no evidence at all that anything would have happened to them whatsoever if they were exposed to COVID. It would have made them stronger, right?
Yeah.
And instead they're breathing this toxic stuff that's now superheated, and oh my God.
Our kids had to wear it on the playground in September, where it's hot here in Portugal. They had to wear it inside and out for prolonged times. They didn't use the single-use masks. They allowed the cloth masks, which we knew did not very much. But it also did mean that they had to breathe in their own oxygen, which has toxic effect. And we can't say, oh, we didn't know any better, because there were already studies, we've covered them at length, showing that masks can be toxic to children. We had them before the pandemic. We just shamed people for bringing it up as anti-maskers, so that like we didn't know. It doesn't cut it, because we actively suppressed that information that was already out there. And yet masks...
I used to get yelled at from people. Man, I would not put them on. I go in the hospitals. They're like, you got to put on a mask. I'm like, no. No, I'm not wearing this. Do you realize this is... And it was never again. Never again. Go ahead, David.
Well, I was just going to say, and what Natalie's talking about, that is the danger of not listening to, like, politicizing everything.
Yes.
That's the danger of everything being political, because then all reason goes out the window because it's been politicized, and you're on this side or that side, and it doesn't matter.
Yeah. Right. And just listen to the science, listen to the data. You can't do it. You can't even post it on Facebook because it'll be banned.
Right. And it was equated with virtuosity. Someone who's willing to wear a mask and is willing to ignore any kind of contradictory science around it.
Well, they also can't go back on it. They can't go back and correct themselves, because then if people question, if they're like, oh, we were wrong on this one part, then people will ask, well, were you wrong on anything else? And they'll be like, well, no, you can trust us. We just had that one thing wrong. So it's like that. So now they've like dug that hole where, like you were saying, like that virtuosity, they've dug that hole. Now they have to be correct. So now they can't go back and change the data.
Yes, you can, though, if you just take a spoon of humility. There's a lot of stupid stuff that, like, I was wrong about because I was actively ignoring those things because I was swallowing the BS.
But I mean, look at Fauci, right? He came out saying in the beginning, he's like, you don't need masks. They don't even really work. Like, they don't even really do anything. Like, you don't need to wear masks. Like, they don't need to do that. And then suddenly it was like, yeah, now we need to wear masks every day. Everywhere you go, make sure you're wearing a mask. Make sure you're masking up everywhere you go.
Right.
Like, okay. And he, years ago said the flu. Like, if you've already gotten the flu, you absolutely don't need to go and get a vaccine. He's like, that's the best defense you possibly have. He said it emphatically. So what was he saying 10 years ahead of time?
Right. I mean, you can be humble and say, I was wrong, and I listened to the shaming of people that were asking legitimate questions.
Yeah.
And I fell for that. I say it all the time. And so, yeah, you absolutely can go back on those things if you are humble enough to do that and say, I wish I hadn't done that, right? And yet mask mandates are starting to pop back up. Joe Ladapo, the Surgeon General of Florida, rang in on this on Twitter this weekend, saying that people should consider refusing to participate. Now, we've already covered that today is my birthday. That makes me a Virgo, and I am a rule follower. This makes me very uncomfortable. He's saying, how about refusing to participate?
I love it. I'm the rule breaker.
I'm going to hyperventilate a little bit because I don't like, I mean, it's like, the thing that makes me uncomfortable is, like, for instance, it's not the person you're talking to that made the rule that has to enforce it. And so when you push against someone who's just like, these are the rules, you have to wear a mask in the hospital, I can't let you in otherwise, right? And so you're pushing against that dude who's just like, a paycheck employee. It's not right. I don't like this idea. But I'm going to tell you right now, there's no situation in which I'm going to send my asthmatic daughter back to school in a mask.
No, never, ever, ever again.
Absolutely not.
I will never, ever again. And I love the idea that he's saying, if someone's calling on you to push on mask policies that have, as he says, proven ineffective, and restarting lockdowns, what he's saying, restarting lockdowns that are known to cause harm. We have monumental amounts of data now about the long-term effects of lockdowns, the depression, the setting children back, speech impediments, setting children back years in development. Absolutely devastating to humanity what they did to us. Never, ever, ever again. We should stand up to this. We should never, ever listen to these people and question everything.
And I would say, fortunately for us in this round, the mainstream media at the end even started doing things on what happened with the kids wearing masks that extended a period of time. So now we even have the mainstream establishment media to point back to and say, they just said this like 3 months ago.
Yeah.
Right. Yeah,
right.
Yeah.
I mean, I think
they'll probably
that
wipe it away though. They'll hide it like they usually do.
Oh yeah. Oh yeah. They always do. But
yeah. In catching up with the news today, Clayton and I were discussing this seriously. Like, what if they do come back to the school that our kids go to? What if, mask mandates or vaccine requirements? We'll move.
Yeah, absolutely.
We'll move before we do that again to our kids. I want to bring this up because I think that it's important to rewind the tape a little, because in the absence of a government that will make medical policy based on human need, what choice do we have? In the 1960s, we had an academic and a physician named Thomas Saz, who was warning about what he calls pharmacracy. He talked about how the Nazis actually used medicalization as a form of social control, and look how that worked out. And he warned us about how this is not what the founding fathers had in mind. I recently read his book, Pharmacracy, and it really is informing how I feel about the increasing medicalization of everything, literally everything. I have fear of this or this that needs a pill, or anxiety about this or whatever. This now has bled into our civil liberties. Here's what he said. He said, the founding fathers sought to protect the American people from the religious tyranny of the estate, regardless of the religion. They did not anticipate and could not have anticipated that one day medicine would become a religion, and that an alliance between medicine and the state would then threaten personal liberty and responsibility, exactly as they had threatened an alliance between church and state. They wrote separation of church and state into our Constitution because they realized that that is the only way that we can have freedom. But now that church has been replaced with an alliance between biopharmaceutical and state, we have lost our liberty. And he was right. And again, he was warning about this since the 1960s. He died before the pandemic, and he would have had so many I told you so's coming. I do recommend that you seek out the work of Thomas Saz, because we are living in this post-apocalyptic nightmare where the separation of church and state is still one of our values, but we have no separation between biopharmaceutical and state, and we are screwed because of it. It's dangerous, and it's not making our lives better. So I'm just going to end on that. You let me know what you think, and that's what we have for you on this first show back.
Yeah. So guys, thank you. Go ahead, Phil.
I was just saying, I'm just really happy that bloodletting is no longer like the current medical trend, because if the government was forcing that on everybody, I mean, but you kind of put that in perspective. I mean, that's like whatever the current medical trend is, they can force that on you. Like, I'm just glad that some of these things are not in prevalence anymore.
Yeah,
but
I mean, look, it was
for how long?
Yeah, absolutely.
Exorcism for certain ailments. Bloodletting, like things like this that would say, well,
that's how George Washington died. I mean, they killed George Washington by bloodletting him. Like, this was like, yeah, well, you got this. We're going to let some blood out. Just going to drain some blood out. We have nothing else to cure you with. And then it was amputations. Oh, you got a thing, you got a problem in your foot. I'll just amputate it. So the amputations. And then, and eugenics, what's next? So, well, now we're just letting people cut off all parts of their bodies. That's the way we go.
Now you can't be sad. Like, if you're sad, you got to get on medication.
Right.
Yeah.
Yeah. I mean, he has this whole part about how the Nazis used, cancer research to sort of take away civil liberties because they were doing some good things and then like a lot of bad. And he talks about how like there really is no mental illness. It's not a disease, a cellular disease on your brain. There is absolutely mental discomfort that we should socially support, but the biopharmaceutical industry does not have any business there. And this is creeping into every bit of our lives and making us weaker and putting people on a welfare state where they are easy to control by the
drones.
government.
Obedience.
We've bought into this. We've bought into this when we agree that every little discomfort is an actual disease when it's not.
Yeah. Yeah. They want drones. They absolutely want drones so they can have total control of them. And I say, question everything. I saw people in the chats agreeing with me. The other day we were talking about authoritarianism and just authority. And I told my kids, I said, you should always question authority. Always question it.
Not mine, though.
Yes, you should. And especially ours. But you should always question authority, and you should understand. You should ask the question it. Why? Why is this rule in place? Why are you telling us to do this? Why? Explain it. Make sure it's explained. And if it makes sense and it can, it helps people, then okay, then it's up to you to go along with it. But if it helps lower entropy, right? Why is this rule in place that we don't kill other people? Does it help to lower entropy? Yes, it does. It helps us to make a more peaceful and better place, right? Right?
Yeah.
You
I don't know
that?
where you're going with this.
I'm just saying there's certain rules that, yes,
of the world.
It makes sense, right? Well, forcing us into lockdowns and mask mandates. And why? Why are you doing this? Why are you forcing people to be out on a playground or, they can't order certain types of food at a bar during a lockdown, but you can go to this establishment or get your dog washed at this building, but you can't get your dog washed over here at a.
Well, and,
sure.
that's exactly, I get what you're saying, because you're saying like with your kids, for instance, like if I say this, then if it doesn't make sense, ask me why. It's like, if you ask us to do this, just make sense of it. If they could have made sense of lockdowns and showed us data instead of hiding it and trying to hide everything for 75 years, maybe we could get on board with information. But It's like if you're making decisions like that and listening to people with no information, that's just control.
Yeah.
And you're blocking other voices.
We've handed our liberties over to the biopharmaceutical complex to our peril. And, the sort of things that we're talking about, like mental illness, these social discomforts have existed for, all of humanity, gender dysphoria or what have you. And there were social organizations in place in order to help with those things, anxiety or what have you, postpartum depression. The answer is not a biopharmaceutical company that takes away our liberties to question those things. So then why now might I not be able to question pharmaceutical trials of a postpartum depression drug because that's been taken from us as a society, right? And so I'm not saying that people don't suffer from mental maladies. That doesn't make it a disease that then we should give up our society for.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.